Welcome. Thank you so much for joining us tonight for our webinar. I'm Jenna Fields. I'm Sharsheret's Chief Regional Officer, and my pronouns are she and her. And this evening's topic, From Diagnosis to Dignity, LGBTQ plus lives in cancer care, is such an important one. I want to take a moment to thank our sponsors for the program. Thank you to the Vassar Center for BRCA, Cedars-Sinai, Genentech, Novartis, and the Cooperative Agreement 24-0061 of the Centers for Disease Control and Prevention. And I want to thank our community partners who are listed on this slide for their support. That includes Beth Torah Beni Rock Campus, Congregation Ahavath Chesed, Congregation Shaare Emeth, Eshel, Ikar, JQ International, Keshet, Sojourn, Svara, Temple Beth-El of Northbrook, Temple Sinai of Hollywood, and Temple Sinai of North Dade. Just a few housekeeping items. Tonight's webinar is being recorded and will be posted on Sharsheret's website along with a transcript in the coming days. And participants' faces and names will not be in the recording. However, if you want to remain private, please follow the instructions in the chat box. My colleagues are putting it in the chat now. And we also have closed captioning available, and that information is in the chat as well. You may have noticed that you were muted upon entry into Zoom. Please stay muted during the call. We are going to have a Q&A following our presenters' presentations. Please type that information into the chat box as we're going. I'll monitor the Q&A and then we'll get to your questions, as many questions as we can after they're finished speaking. And as you know, Sharsheret is a national not-for-profit support and education organization and does not provide any medical advice or perform any medical procedures. The information provided by Sharsheret and tonight's speakers is not a substitute for medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem. If you have any questions that are specific to your medical care, always seek the advice of your physician or qualified healthcare provider. And before we begin, I just want to acknowledge how difficult things have been recently, both in Israel and also in the United States. And our hopes and prayers and wishes go to everyone who's experiencing feelings of worry and fear, including those in the LGBTQ plus community. Our hearts are truly with everyone. And now it's my pleasure to move into this really important webinar we're doing tonight. I'm so grateful to all of our speakers who are joining us. We're going to start tonight with two cancer thrivers who are going to share their personal stories. And first, I'm going to welcome Sandra Chefitz, who's going to join us right now. Sandra, we're going to spotlight you. And Sandra is a Sharsheret program participant. She's vice president at Munich Re North America Life. She and her wife, Marion, split their time between Brooklyn and upstate New York. Welcome, Sandra, and thank you so much for being here.
Thank you so much for having me and for facilitating the conversation. I was diagnosed with breast cancer at 45 at the end of 2022. And just a quick plug for Sharsheret to kick off, I found out I had cancer through my chart, which is not uncommon. And I was obviously overwhelmed with fear about what treatment was going to look like. My mom told me about Sharsheret and I reached out and I heard back within a day, and I will always be grateful for that. Marion, my wife, has been as involved as I want her to be at every stage. I tell people that one of the upsides to a same sex relationship when you're navigating medical bureaucracy is that I've never had to make a phone call to a doctor, insurer, pharmacist. Marion impersonates me on the phone, and she is sparing me so much of the administrative overhead of cancer treatment. She's saved my time, she spared me the frustration, and my advice to anyone is if you can enlist people to do the same for you, it's going to make a huge difference in managing some of the smaller daily stressors. Um, it's common for women to grieve the loss of traditional femininity during and after cancer treatment. Uh, as a lesbian, a unique challenge might be this continuous reflection of your losses. So I've lost most of my hair twice now. And it's hard to watch Marion blow dry and style her hair and even brush it when I'm preoccupied with all of the daily rituals to try to keep mine. And we're exactly the same age, but I feel a lot older than she is now, with night sweats and leg cramps and fatigue and memory issues. I'm in menopause and she is not. And I'm reminded of that every time I open the cupboard. At the same time, I don't think anyone could understand all the things that I've lost and how difficult the last couple of years has been as much as she can. She's a woman, she's the daughter of a 2-time breast cancer survivor, and she's the most empathetic person I've ever met. I was diagnosed about 4 months after I lost my father to cancer quickly. So I started the process with probably a healthier mistrust of doctors. And I'm sorry about the doctors that are here than most people, but doctors are human and they're overworked and they can't allocate enough attention to all of their patients. And if you're not the kind of person that just goes along with the plan without questions, you're inevitably going to face challenges in getting your needs met during treatment. I had questions at every step, and I asked for things that definitely weren't unusual, but weren't protocol on the assembly line of care that I was moving across. I was well informed, I did a lot of research, and it was still very difficult to obtain access to tests or medications that I asked for, to get the right follow ups to manage side effects, and to convince my providers that I know my body better than they do. Um, Someone on a podcast observed that if you're hiring a contractor, you get multiple quotes, but many people get just one oncology opinion. This is your life. Try to find someone who listens and who understands your priorities, if not your values. And do your own research. A lot of what's helped me better manage short and long term side effects, I found through my own research, and then I asked for either from my oncologist or my primary care physician or gynecologist. Treatment can leave you kind of broken, and it hasn't been my experience that your oncology team is going to be active in helping to put you back together, and that's just not their job. You have to take the initiative and enlist support from other medical professionals. And then last, don't worry about being liked. Again, this is your life. You're hiring a doctor to treat your cancer and not be your friend. Be as assertive as you need to be.
Thank you so much, Sandra, for sharing your personal story. It brings so much to this conversation, and we're grateful you're here today.
Thank you.
It's now my pleasure to introduce Gabriel Glissmeyer, who holds a Master's of Public Health and is a longtime LGBTQ plus health professional with a background in tobacco prevention, oncology, and HIV. As a transgender adoptee, Gabriel has had to navigate a family history of cancer while being confronted with a healthcare system not built for transgender people or adoptees. Fueled by his own adverse experiences with healthcare and public health systems, he has used this as a springboard to create national programming, educate healthcare providers and public health workers, and bring awareness to equity issues. Welcome, Gabriel.
Thanks for having me. I'm super happy to chat about my experience through the healthcare system as a trans person. So, one of my main concerns as a trans person was ultimately that I would find out that either I'm at risk or get diagnosed with a cancer that was exacerbated by hormone therapy. So, after having had top surgery, I wasn't really concerned about breast cancer, but I was unsure about what it could potentially mean to have to pause or stop transitioning altogether and how I would potentially cope with that really difficult reality. So I was adopted, and when Ohio opened up their adoption records about 9 years ago, I learned about a very aggressive ovarian cancer that was in my family. And I let my providers know, and they said, we'll worry about it when, your mom gets it or you have a sister that gets it. And so by 2019, my birth mom was diagnosed and died from the cancer. And in the middle of 2020, I had a pretty drastic change in health. And by the next day, I was scheduling surgery and being sent resources about hereditary cancer. So, kind of navigating the system, aside from not having any family medical history until my mid-20s, the biggest challenge I faced was how many misgendering hoops I had to jump through to prove to the insurance company why someone who is listed as male for gender and sex on pretty much everything would possibly need to have gynecological organs removed. Another area of misgendering that I experienced was actually in genetic testing. So despite all of my medical charts listing my gender and my sex as male, um, pretty much to do my genetic testing, they had to list me as female to have it all make sense. So for anyone who has clients or patients who are trans, who are previvors or concerned about cancer in their family, just know that the testing actually can be very triggering to trans patients or clients. as it can, place them specifically in a male box or a female box. And obviously that might not match their gender identity. But I was very lucky to have a lot of very trans affirming providers and surgeons in Utah who let me use back doors to get into the exam rooms instead of needing to sit in the very, very pink waiting rooms in the women's centers. Basically advised me to ignore the very gendered language and all the ovarian cancer pamphlets that I had, and basically told me to let them know immediately if anyone from the front desk staff to ultrasound tech said anything negative about trans people in front of me. So I've been very lucky in that way. So I haven't delayed or avoided appointments because of transphobia or how I would perceive to be treated as a trans person. But I definitely, I'm willing to admit this, I have avoided things like pap smears because one, I only ever saw them advertised for women. And two, I also knew that they would be very, very uncomfortable as someone who has been on hormones for a very, very long time. So in that case, it was really helpful to have providers who were so trans affirming, who could explain everything in detail, and were really forthcoming with ways to minimize that discomfort, like prescribing me with mild sedatives during my pre-op, post-op, and also during my transvaginal ultrasounds that I had to do. So as far as my tips and tricks for self-advocacy for other, LGBT folks who are at high risk, honestly, just be sure to voice any concerns that you have with your providers, especially around any preventative services, because those are so important on this journey. If you're worried about discomfort or not sure about what a procedure is, just let them know they want to help you. And then reaching out to organizations like Sharsheret and talking through some of your options for support and connecting to other LGBT folks who have gone through similar situations, because it's really hard to carry this alone, and you really shouldn't have to carry this alone.
Thank you so much, Gabriel. Your experience is so enlightening and really important, and we appreciate you being here this evening. Now we're honored to have Alex Trifonov with us this evening. Alex is the program coordinator for the LGBTQ plus cancer care and research program at Perlmutter Cancer Center at NYU Langone Health. In this role, he actively navigates and advocates for patients across the cancer continuum, from screening to diagnosis, treatment, and survivorship, with an LGBTQ plus proficient framework. He holds a Master of Biomedical Sciences from Rutgers, and his work spans patient advocacy, staff education, community engagement, and health equity research, with a focus on drivers of health in LGBTQ plus communities, including LGBTQ plus immigrants. Now, as a reminder, if you have any questions, please put them into the chat or privately message me, and we'll save them for the Q&A following Alex's presentation. And now I'm happy to welcome Alex to the screen now.
Thank you very much, Jenna. It is my pleasure to be here. My name is Alex Trifonov. My pronouns are he, him, and I'm a program coordinator for the LGBTQ plus cancer care and research program at Perlmutter Cancer Center at NYU Langone, in the heart of New York City. So I will be, so I, 50% of my job is active patient navigation and patient advocacy for LGBTQ plus folks within the cancer continuum and the non-cancer continuum, even when we have to do some screening and prevention. And as you probably could have guessed from my last name, I also speak Russian. I'm originally from Uzbekistan. So I do have a big population of Russian-speaking LGBTQ plus refugees from all post-Soviet Union countries that come to the United States and seek asylum and refuge, and also need lots of services as they come to the US. So let me just share my slides first, and please let me know if you can see them. Yep, great. Alrighty, so this is everyone should know this, right? Cancer knows no gender, right? If you have it, please screen it, right? the very big focus that we do here at NYU Langone is, and more specifically at Perlmutter Cancer Center, we do organ inventory on all of our patients, right? So if we have, doesn't matter of gender identity, doesn't matter of sexual orientation of a patient, we do ask those questions as well, and sex assigned at birth. We do ask patients of what organs do they still have, right? Or what organs does have augmented or removed, right? So we wanted to make sure that you get all the screening and prevention services depending on what organs you have, okay? So let's dive in a little bit in LGBTQ plus health disparities, right? In general, well, we all know this, right? But why do they exist? It's because of discrimination, prejudice, stigma, and other negative factors in a society. And minority stress, right? You all know that as well. uh, so they, because because of all of this negative impact from the society, the community have a higher rates of tobacco, vaping, alcohol, substance use. They get denied care. They have eating disorders, anxiety, depression, and unfortunately suicide, right? So the rates are in LGBTQ plus community specifically are higher for all of those categories that I've just mentioned. So how about cancer-wise, right? So, we have overall health disparities, right? Now we kind of like going in another layer of cancer, right? So what does it lead to, right? First of all, very, very big one is lower cancer screening rates, right? That's what we care as number one priority for anyone who we talk to, or I do the intake as a patient navigator, right? The first thing I go over in my brain's checklist of what cancer screening and prevention services they need to do, okay? It also leads to higher incident in cancer diagnosis, right? Preliminary at Perlmutter Cancer Center, we do see that LGBTQ plus folks come to us with a later stage of cancer. That's more research needed, but that's what we know so far. So statistics wise, this is national statistics, right? We're not talking just New York City. About 81,000 LGBTQ plus folks will be diagnosed with cancer each year. This is really sad. Um, and some going into more into identities and sexual orientations. We have lesbian and bisexual women are 2.3 times more likely to receive any cancer diagnosis. Gay men are at increased risk of anal, prostate, and HIV-associated cancer and are diagnosed at a younger age. And transgender and gender diverse folks are 2.3 to 3 times more likely to have infection-induced cancers. And I will explain what the infection-induced cancers mean in a little bit. What we don't know, right? The incidence per cancer type, right? We don't know how many LGBTQ plus folks get cancer in a certain disease group, right? Like let's say breast cancer, breast or chest cancer. We do know somewhat from the statistics, but we don't know the accurate number, right? Just because folks just not comfortable sharing their identity, right? We are lucky to be in the heart of New York City, so lots of more patients are open, and I would like to recognize that in parts of the country there are places that LGBTQ plus folks are not as open, or the healthcare is not as great as here, right? But and also what we don't know is cancer-related data in racial and ethnic LGBTQ plus minorities, right? There's not enough data, right? But it's still an issue. Like we know the health disparities are there are layers of health disparities, right? There's a LGBTQ plus minoritized group, and there's also racial and ethnic minorities, right? And if we combine those two, then the health disparities get even worse, right? So we need more data in that field as well. But why is there's not enough information, right? So we all know there's not enough, but why and what can we do, right? So underreporting and non-collection of sexual orientation, gender identity, or as we call it, SOGI, or some people call it SOGI. Can't stand SOGI, but love SOGI. So, and across the nation, right, which is challenging. And again, that goes towards recognition, being in New York City or versus another state or city within the United States where the healthcare is not as accessible for the LGBTQ plus folks, right? Not having an LGBTQ plus proficient clinician, and you deserve one. Everyone deserves a proficient clinician that is proficient in your care and your health needs, right? So please advocate for yourself, or have folks who can advocate for you, or find navigators or advocates that can possibly help you with to do this, to make this as the first step, right? And I'm talking about not just primary care, oncology, GYN, urology, or anything like that, even orthopedic surgery. As as we can say, it's not cancer related, but even in any specialty that really matters, right? So LGBTQ plus folks are avoiding disclosure of SOGI and sexual practice information due to obviously stigma, prejudice, and other negative factors. And social drivers of health or social determinants of health are affected, right? That's we're talking about housing, jobs, mental health, environmental factors, schools, mental health resources, and other things, right? And cancer prevention wise, right? So I love my focus on cancer prevention. And if you can prevent it, that's amazing. And you have much better chances if we catch it to treat it and cure it. Why LGBTQ plus folks are less likely to undergo cancer prevention and screening services? Not having health insurance, that's a big thing, right? Gendering of cancer screening, and Gabriel, thank you so much for saying that about having being in a facility when you're giving a pink gown, a pink brochure, right? When you're being a trans man or someone from, if gender other gender identity, right? That is not a cis woman or trans woman or any other identity, right? So um, lack of the primary care clinician who's a proficient in your care, previous negative experiences, right? If you had a negative experience, you're less likely to go for the same service when you need it again, right? And I'm talking about specifically also, like Gabriel mentioned, and thank you so much for saying that, pap smear for trans men, right? This can be highly traumatizing. That's why we need to make sure we have a GYN or PCP who can definitely take care of that in a very proficient manner, in a very comfortable manner, and listen to the patient, right? And acknowledge what patient wants. Um, Obviously, patients and there's a clinical lack of knowledge in healthcare and how to screen for certain cancers specifically, right? Which we're going to dive deep in a little bit. And denied care by clinicians, right? That unfortunately still happens. We wish it could be different, but it does happen, unfortunately. So how to prevent cancer? Big question, right? So in general, what can we do, right? Is obviously, you're gonna go to your primary care physician, and your primary care physician will mention those 4 categories. What can you do, right? Healthy eating, exercising, reducing tobacco use and vaping, reducing alcohol intake, right? Even if you do one of those, you're already reducing the cancer chance, right? For yourself, any cancer, right? We're talking about. So more you do, obviously, the better. And there is help that is available for each of those categories, right? And again, the city where I provide my services, and we do have lots of services. So for people who's like, I can't find this service, there is a possibility, right? Obviously, for some folks, it could be much more difficult. And again, I want to recognize that as well. Okay, again. Infection prevention, right? HPV or human papillomavirus, as simple as you can get a series of 3 vaccines, right? And I do like to ask this question and at all my community outreach and educational events. And I ask the community, I was like, so who should get an HPV vaccine? And they're like, everyone. The answer is everyone, right? Obviously, there's certain age restrictions, but everyone needs to get HPV vaccine, right? No matter of your gender identity, sexual orientation, sex and birth, none of that matters. Everyone needs to get it. Hepatitis B, hepatitis C. Obviously, hepatitis B, again, we can give vaccination. Hep C, there's no vaccination, but we can do blood work, right? We can keep checking for that. And if, unfortunately, if you haven't received diagnosis sooner, that's better. You can treat it and cure it, right? And it is curable now, so please get tested. And then H. pylori, right? It's we know that if you have some certain symptoms and like acid reflux or anything, don't ignore it. Go see your gastro and have them test you for H. pylori. And if you do, please get treated because throughout some time it can cause stomach cancer. It has a very high chance for that. Okay. And HIV, again, if you don't have a diagnosis, there are PrEP and PEP options available, right? PrEP is to prevent HIV, and PEP is post-exposure prophylaxis, right? So if you had a contact and you happen not to take in PrEP, then you can take PEP, right? But it is preventable, right? So there are resources. And if you do have a diagnosis of HIV, there are also a bunch of medications available and that you can take and they can help control it, right? And if you are controlling HIV, I know people there are some studies before that were the physician like to mention this, like someone who has an HIV and has it controlled have the same life expectancy as the person who doesn't have an HIV, right? So just keep that in mind. Okay, and this is the big one, right? Find LGBTQ plus proficient clinician and their service, right? Once again, I think I'm saying it for the sixth time already. It is important to find one, but I do want to recognize that it's difficult for some folks. If you need something, just ask, right? I mean, even if you don't know anyone, and if it's problematic in your area, just reach out to someone even outside of your area. They might have colleagues, right? I mean, I do talk on my personal experience, for example, we all communicate throughout the country, right? And if you haven't heard someone, maybe I've heard someone from NYC and someone has in Oklahoma who provides such care, right? So just ask no matter who, and if you know this person knows someone, they'll be amazing, right? Okay. Um, all right, let's dive into screening guidelines. There's lots of info, no slides. I'm just gonna simplify it, and we can definitely send those slides to everyone who's registered later, and I'm happy to share them, obviously. So for breast and chest cancer screening, right? Again, if you have it, screen it, right? And the reason why I'm listing here gender identities, you can be like, but you just said, if you have it, screen. It does. Some factors matter, right? So the National American Cancer Society guidelines for breast chest cancer screening say you have to do annual mammogram starting at age 45 until 75, right? That's the standard guidelines. They don't even mention cis women, trans women. They just say just women, right? So those are someone who was born as a woman, right? So for transgender women, right, we have if this person is 50 plus and have a 5+ year of hormone therapy, then they need mammogram every 2 years. Okay. For trans men, depending on anatomy, right, if the chest masculinization was done, there could be some residual tissue still there, right? This is very important to know. Chest masculinization does not equal typical mastectomy for breast cancer. So some mammary gland tissue gets left behind. So you need to make sure you screen that tissue for cancer, right? Obviously, if you have some family history, genetic history, it's much more earlier, and then you have to do testing and possibly get screening much earlier, right? Like MRI, for example, especially specifically from trans men I'm talking about. For cis women, national guidelines. For cis men, there's no recommendation unless symptomatic or significant family or genetic history. And then other identities, again, organ-based approach and status of taking gender-affirming medications. Okay. Now, cervical cancer screening, anyone who has cervix, right? Again, no identity, anyone who has cervix, right? So national guidelines from ACS, again, tell us to start at age of 25 and pap test every 3 to 5 years, and HPV co-testing or human papillomavirus co-testing. Again, if you need it sooner, your physician will tell you, depending on the result, right? But if it's negative and HPV is negative, 3 to 5 years, right? That's the usual guideline. For trans women, no screening because again, there's no cervix, right? And there's no surgery to, augment cervix, right? So there's no need for screening. But again, if there are some HPV-related lesions in neovagina, right? If someone had a vaginoplasty and they had a reconstructed neovagina, then they need some HPV screening on that, right? And this is very detailed, so that's kind of have to discuss with your physician. For trans men, if cervix is present, but if testosterone should definitely be indicated on a report or on the order that person is taking testosterone, because that will affect cytology or cells on the sample. So that needs to be mentioned and differentially diagnosed by pathologists when they're looking at the sample. Again, increased risks of abnormal testosterone, that's what I just said, and no screening if cervix is removed and there's no history of high-grade lesions. Cis women, national guidelines. Cis men, no screening, no cervix, right? And other identities, again, organ-based approach. Okay. Uterine endometrial cancer screening, no recommendations from ACS, but for trans women, no uterus or no endometrium, no screening. For trans men and other identities, also no screening, but if uterus is present and there's an unexplained genital bleeding, then it needs to be evaluated, right? And also screened for cancer. Ovarian cancer, no recommendations, again from ACS, official ones. And there's for trans women, no screening because no ovaries. For trans men and other identities, also no screening guidelines we're talking about, right? But if there are ovaries and there's significant family history of breast or ovarian cancer and/or ovarian cancer, then we need to, they may require genetic counseling and further testing. Anal cancer screening. This is kind of a newer cancer screening test that everyone that we kind of spreading word about, and kind of people start thinking about it. People don't know much about it, even in New York City. I was just doing it at Brooklyn Pride. We had a Brooklyn Pride on the 14th, and I was, a table there, and I was, just asking people in the community. I'm like, do you know what anal pap is? They're like, nope. I was like, so I think I only had 2 people who actually said that they know what anal pap is, right? So that is a test for anal cancer screening, right? And I'll explain a little bit. So no official recommendations from ACS. We have beautiful anchor study that tells us how to screen from IANS, International Anal Neoplasia Society, that also tells us the guidelines for that based on research. So typically we have high risk population, medium risk population, and low risk population. So high risk population, if someone who's over 35 and HIV positive, men who have sex with men or transgender women, right? I kind of just say in general 35 plus with the HIV plus, right? So that's it, no matter of identity. But then we do anal pap every 1 to 3 years, depending on the result, right? So anal pap, like a cervical pap smear, but it's from anus, right? You take a sample with HPV co-testing, ideally. Then you screen it, and if it's negative both, then doctor will tell you in a year, from 1 to 3 years. And if it's positive, then they go for basically same thing as colposcopy for cervix, but it's called HRA, or high resolution endoscopy. It's basically looking at the cells of anus in real time using a microscope, right? Some, like for example, then we just launched a new program, so we have it ambulatorily now. It used to be NOR, which is you have to get anesthesia, a day off, so it's like someone needs to, pick you up or whatever. But now it's done ambulatorily, so you can just come and get it done. And if you need a biopsy, they will do the biopsy there as well. So that's for anal cancer, right? For 35 plus, HIV plus, right? And someone who's 45 plus, HIV negative folks, and other HIV positive population, and if someone who is a test 10 plus years in solid organ transplant, and someone who had vulvar or cervical dysplasia, especially HPV positive dysplasias, right? So if anyone who has cervix had dysplasias and HPV positive, they also should be screened for anal cancer because of the very close proximity anatomically, right? Okay. Colorectal. For all LGBTQ plus community members, we should say 45 to 75. 45, that's this standard screening age, right? Again, the gold standard is colonoscopy. I don't know who does sigmoidoscopy anymore, but I had to put it there because that's the guideline. Or stool-based test, right? So colonoscopy is kind of longer camera, and sigmoidoscopy is like just screens the lower parts of colon and sigmoid colon, right? So that's the difference. And again, if it's normal, 10 years. If it's not normal, physician will tell you. And it will take polyps out during colonoscopy, right? And if you have someone you have family history and genetic history, you should do it sooner and talk to your PCP and gastro to see if you need to be screened sooner than 45. And if you have transgender women after vaginoplasty, this is like really important because I don't think lots of people know about this. If trans women had a vaginoplasty, basically had their new vagina constructed, right, surgically, there are instances when the part of colon can be used, right, as the vaginal canal. So we need to make sure we screen that new vagina as well for colon cancer, right? Because the tissue is the same, right? So we want to make sure there are no polyps or anything there. Genetic counseling, want to make sure that obviously have a risk, get that done. often is recommended for cancer if you have a cancer diagnosis in a family member, especially immediate family member, personal diagnosis of younger age, and undergoing gender affirming procedures, right? If especially we're talking about top surgeries, right? That's definitely, at least at NYU, they prefer genetic counseling. And helps identify prevention strategies, but there's still many, many, many unknowns that we don't know. So, um, yeah, and that's all about the screening and genetic counseling. I know there was a lot of information there, but again, you'll get the slides, so that's okay. You can always look them up. But I want to share resources with you. Those are national resources, and then please feel free to snap a screenshot or take a picture of that, because I feel those resources are really important. And obviously Sharsheret should be number one here. But that's I kind of assumed before putting the slide. But there is a national LGBTQ plus a cancer network. They really proficient in everything from prevention all the way to survivorship. So if you ever need help of anything, feel free to reach out to them or to me, and I'll help you out. Just kind of send them. There's a coordinator that we can just connect them directly to you with them. And there's obviously other organizations like SAGE for LGBTQ plus elders, especially in New York City, they're really big. And Cheeky Charity for it. This is the anal cancer prevention and colorectal cancer prevention organization. And we have FORS, the genetic counseling, and many others on this list. Just mention those big ones because they pertain to the slides I've just presented. Don't hesitate to reach out. I put my information, but again, I understand that some of you may not be from New York City, and that's totally okay. You can also reach out to me, and I can do my best to help you out. But just know help is always available. It may not be within a very close proximity to you, but there's always help in any case. We usually, on the behalf of the Perlmutter Cancer Center, we do have LGBTQ plus patient and family advisory council that we ask our patients if they want to be part of that or their caregivers, and it's open to everyone who got treatment at our institution. That helps us to kind of like adjust protocols or create something new. And you have no idea how many numerous advices that I've got from them for my community outreach events, and those worked out so beautifully. And I'm so thankful to that little group of folks that are just incredible and spend their time with us every 2 months for a whole hour in the evening when everyone's tired. So also there's our website. You can I put a QR code there. You can just snap out the picture of QR code and check it out. There's also a website. Email that if our program comes to me. So yeah, and thank you so much.
Thank you so much, Alex. That was so informative, and I really appreciate your expertise in this area. It's vast knowledge. And I see that Gabe is adding some extra resources in the chat, which is wonderful. A few questions that have come up, and feel free to add questions to the chat during this Q&A. Alex, I'd love you to expand a little bit about why genetic testing is so important before someone is considering a top surgery or a mastectomy in this context.
Yes, thank you for the question. And if you getting a surgery, especially top surgery for trans men, right? We're talking about chest masculinization. It's not a typical mastectomy, right? So no surgeon, or you as a patient, no one wants to find out a surprise in the OR when they take out your tissue, right? So especially if they're trying to masculinize your chest, right? So sorry, it's a hard word to pronounce. And they leave some tissue behind, right? So they want to make sure that if that's the case, then they do genetic testing. And when they take out the tissue, they send it for pathology no matter what, even if it was negative. So yeah, that's why it's really important. And also it reduces risks for like ovarian cancer, for example, right? So if you genetic, testing positive, then, they're obviously, have to make sure that you have to screen yourself for ovarian cancer.
Yeah. So I really appreciate the conversation around providing a proficient provider. I don't think I've ever heard that particular language before, and I found it so valuable. And Gabriel, you spoke about that as well. I I'd love for you to share maybe a little bit of tools that patients can have in their toolbox when thinking about finding a proficient provider. What are some of the things that they should be looking for, thinking about when finding the right match? And Gabriel or Alex, either one of
Like, I
you.
guess I can go. Um, yeah, I mean, I think there's a lot of things folks can look for. So sometimes, so I used to work at the National LGBT Cancer Network. So we would tell people all the time, like, there's some visual identifiers of like, are there flags places? People have pronoun pins on. When the provider knocks on the door and like quickly opens the door, do they say like, hi, my name's Dr. So and so, and I use XYZ pronouns? Like what's your name, what pronouns do you use, those types of things. So yeah, so some indicators like that, or kind of as you're looking on the website for different clinics or hospitals, sometimes you can look at the provider's experience. So sometimes they'll have won awards for things, or they will have done a specific fellowship specifically for LGBT folks. So yeah, so there's some indicators like that. Sometimes I really like Googling, doing a really quick Google search for like the full name of my provider, and that usually brings up a lot of stuff. So if they've done webinars, if they've published papers, anything kind of like that, or kind of like Alex said too, sometimes just reaching out to either folks in your community locally and being like, hey, I'm looking for a new provider. Do you have any recommendations? And they might be like, well, I don't have anyone, but I know some people who might, and that's how you can also get some great providers.
Wonderful. Alex, I don't know if you have anything to add.
I'm just totally piggybacking what Gabriel just said. I think yes, it's really important. So, for example, here when I teach staff and faculty for LGBTQ plus knowledge and awareness, I always tell them, I was like, listen, I want to like I have a pin which I want to show you, right? So we have those pins, right? So they're like, can I have a pin? I'm like, nope. Did you do the training? They're like, what do you mean I want a pin? I was like, no. Visibility is great, but visibility is nothing without support. So yes, I hope more places think the same way, because I feel like that way, if let's say like someone sees your pin and they're like, oh my God, hey, I'm sorry, I need can you refer me to this whatever ABC resource? And I'm like, I have no idea what you're talking about, right? Or on the other hand, is like, oh, listen, actually, you know what? I don't know, but I know the person I can connect you to, right? So this makes such a difference, right? Or if
Mhm.
you know, great. And yeah, I mean, just as just do research, right? Like also look up if they have done any like webinars or like talks, abstracts, or anything at like LGBTQ plus conferences. Like, or are they members of those organizations? Also, there is an amazing website now. It's national, called LGBTQ plus provider directory. I can put a link in the chat shortly while we're talking. Uh, it is, you can just like by state, you can just put specialty that you need and or whatever service that you need, and you can have some lists. And again, it's not all inclusive because the providers put themselves on the list, but it
Mhm.
was created by GLAMA and their committee. It's Gay Lesbian Medical Association, which is also expanded to all identities now. Um, yeah, so that is a great website. I'm gonna Google the website now to put it in the chat for everyone.
Thank you. And I know Simone put in one as well a little while ago when you were talking about this. I don't know if it's the same one or a different one.
I didn't see
Good
it,
to
but
have multiple resources.
sure.
Sandra, I'd love to ask you, you spoke so beautifully about the role that your wife played as a caregiver and your experience and some of the challenges that you also faced. I'd love to hear, maybe you can share some insights on how a caregiver, the story you shared about her calling the health insurance company was such a good one, but any other tips for caregivers who are watching this webinar that they can think about when providing support to their partner going through cancer treatment.
Yeah, I think that I think that so much of this depends on the person. But I think that I would recommend that caregivers, significant others, partners, friends read as much as they can to understand what your loved one is going through rather than waiting for your loved one to explain it, and it's hard to talk about and you're tired already. So I did a lot of research. I'm that kind of person, right? I value that in other people, but I think that the best way that you're going to be able to help be there for someone else or take care of someone else is to understand a little bit more about what they might be going through, like keeping in mind that the experience is really different for everyone, but like what are the common things they're going to encounter and how can you get on top of that for your loved ones so that they don't have to, figure it out on their own, and also, walk you through it or explain it to you. So research.
That's great. And Gabriel, I'd love to ask you, I think you were so generous in sharing with us your own times that you've delayed screening and admitting to that. I think everyone can relate to that. It's very easy just in general to put off your screenings, and obviously when you face additional barriers as well. I'd love for you to share maybe what are some affirmations or tips that you can give people when they're going through the mental challenge of making that phone call? What helps to get to pick up the phone?
Yeah, so yeah, I think as I was going through it, I was like, does anyone like pap smears? I feel like they are, I don't think there's anyone on the planet who likes them. But yeah, I mean, it was kind of tough because obviously I was forced to get a pap smear via my insurance to get surgery and everything. But yeah, kind of just, I think the drugs helped for sure that I was prescribed by my OB-GYN, but yeah, just kind of remembering, just like, this is temporary. This is pretty fast. It is, pap smears feel like they're a very long time, but it is seconds essentially. So yeah, like, this too shall pass. This is going to be very quick. It feels really long, but really these are seconds. You're going to be okay. You've been through more difficult things. This is like, a barrier that you have to get through to get, the rest of your care done. And so you can survive this because you're going to have to survive surgery in a couple of weeks. And so, yeah, I think it was just a lot of mindfulness. And, I think in Jewish tradition, you have like Musar, and a lot of that is mindfulness and really just kind of calling on those traditions as well of just, you know, trying to obviously be present in my body while also, trying to forget where I was. Um, but kind of just thinking about how amazing it is that we even have testing and screening like pap smears
Yeah.
and that we can catch these things, and just kind of being present in the marvel sometimes that is cancer prevention screenings.
Yeah. Yeah, definitely. Um, uh, and Mike, I'm seeing some chatter in the chat. I just want to make sure my colleague Sharsheret mentioned that we do have a meditation series that we developed, and also caregiver support. I saw what was written about taking care of yourself while you take care of your loved one. So just please know for anyone on the call that we do offer caregiver support as well. Okay, last question before we wrap up. Alex, you shared just a phenomenal amount of information around screening for the LGBTQ community and considerations that folks should be thinking about depending on what organs need to be screened. Where can people stay on top of screening recommendations, particularly for the LGBTQ plus community?
Two things. The first thing is find a provider that is proficient in care.
I'm glad we're circling back to that.
Yes, and who I know you love the word now, so
Yeah.
meet your LGBTQ plus proficient provider
Yeah.
who educated themselves based on research, based on articles, based on experience of other clinicians across the country and across the world. And that guidelines, the WPATH might possibly put it. WPATH is organization to put together the standards of care for transgender folks. It's a worldwide organization.
Say the name
So
again. I'm sorry, I didn't catch it.
WPATH,
W
WPATH,
path.
yeah.
Okay.
And then yeah, just and to do your own self-education, right? Just like read the papers, read the experiences, and also, yeah, just read up on papers. I think the clinicians who've done their research, and if you don't have such clinician, unfortunately, educate yourself, ask peers and folks that have similar experiences or similar, you know, kind of situation. They've been in the same situations or whatever. But yeah, I think those two things very important.
Wonderful. Well, thank you so much to the three of you for this really excellent conversation. I really appreciate your time and your expertise and your personal experiences. And I feel like I should mention that Sharsheret does have a Know the Facts booklet that's specifically for the LGBTQ community, and it includes information both on hereditary cancer risk in the Jewish community as well as screening for the LGBTQ plus population. So I'll ask my colleague to put it into the chat. It can be downloaded, or you can request a hard copy and we can send it to you. As I wrap up this webinar, I want to thank our generous sponsors, the Vassar Center for BRCA, Cedar Sinai, Genentech, Novartis, and Cooperative Agreement 24-0061 of Centers for Disease Control and Prevention, as well as a huge thank you to our program partners who supported and promoted the webinar. Please take a moment to fill out our evaluation survey. My colleagues are going to link it in the chat box right now.
Just
And
a quick question, if you don't mind. That booklet that you mentioned, is that from the local chapter that I can call to get that?
yes, definitely. And we can send it out as a link after the webinar.
Well, but the link is not good for me. I just through email. It's complicated. But the booklet I can request from Sharsheret local.
Yes, and Helen, I'll have one of our social workers follow up with you after the webinar so we can mail it to you.
Oh, okay, great. Thank you so much.
You're welcome. You're welcome. I'm sorry that link isn't working. But please remember that Sharsheret is here, and we provide emotional support, mental health counseling, financial assistance, and community health education designed to help you navigate your cancer experience. And all of our services are completely free. And we're going to put that information in the chat box as well. One more time, a huge thank you to our speakers this evening. And please fill out the evaluation, and we look forward to seeing everybody soon. Thank you again, and have a great evening.